In this session, we will be discussing Huntington's disease. We will be looking at a brain specimen obtained from a 55-year-old male who had an 11-year history of dementia and sudden jerky movements. He eventually died of pneumonia. One of his three brothers had died of Huntington's disease, and there was a history of presenile dementia in his father and his paternal grandfather. Macroscopically, we can see two coronal brain samples that have been sectioned at the level of the optic chiasma. The lower specimen, which can be seen here, was obtained from a normal individual. In the upper specimen, there is visual atrophy of the caudate here, and to a lesser degree, the putamen here, as well as compensatory dilatation of the lateral ventricles here and here. This becomes particularly obvious when we compare this to the bulging convexity of the caudate in the normal control, as can be seen here. It is also worth noting that in the Huntington's disease sample, there's cortical atrophy across this region here, where we observe thinning of the gyri and the widening of the sulci, as well as the thinning of the corpus callosum. At the microscopic level, you will be able to see marked neuronal loss in the caudate and putamen, as well as atrocytic proliferation.